In a Facebook post this week, MP for Sengkang GRC Jamus Lim called for Singapore to keep revisiting its stance towards mask wearing as the COVID-19 situation develops here. His view, we should move towards relaxing our outdoor masking rules, except where there is still close contact, like in markets and other crowded spaces. Mr. Lim, though, insists on strict adherence indoors. Acknowledging that masks are an important tool in our COVID-19 fight, he said that we can evolve our COVID-19 policy to pay more attention to indoor air quality, especially when we treat the disease as endemic. He added, in an ideal world, people would keep their masks on at all times. But in reality, keeping the mask on constantly is stifling, and there are clear signs of mask fatigue. Here to weigh in is infectious diseases specialist Dr. Leong Hoe Nam from the Rophi Clinic. Welcome back to the show, Doctor. Doctor, what do you make of Mr. Lim's points that transmission risk in open air settings is low, as well as what he said about mask fatigue?
I really welcome Professor Lim's comments because it is really one way where we can take this discussion further. When we actually have a discussion further, we understand the problems and the science of it better. So I appreciate Professor Lim bringing this up. However, I just want to be very cautious to everyone. The science for this transmission outdoors isn't good. As in, we don't have solid science to say there is or there isn't transmission. Overall, we think there is significant transmission outdoors, and there is a transmission occurs with a very transient contact. If we take masks off, in return, we can actually have an outdoor spread. Now, I want to bring you back 1 year ago. 1 year ago in the Rose Garden at the White House, it was a mask-off event with a virus that's less transmissible. So at that Rose Garden, there was a transmission, there was a super spreading event, and many people fell sick because of that. So we don't want that Rose Garden effect to happen onto our garden city. Because if everyone were to take off the mask off just like the Rose Garden, there'll be many, many cases. Now, come back again, the science to say that there's a lot of transmission outdoors isn't good. But like all academics would say, in the absence of evidence, this isn't evidence of absence. Just because we haven't done much research on it, it doesn't mean that there is no transmission. So, but Professor Lim is right. All of us are tired. We are really very tired of the mask. But I want to take you to the healthcare workers. Look at the A&Es now, 6 hours wait. You're talking about 1 day before you can possibly get a bed. The healthcare workers are very, very tired. There's a plea going out to the public from Professor Terence Key, a friend of mine from Singapore General Hospital, say, please stay in. We are really burdened. Our hospital system is being stretched. And I think Minister Ong Ye Kang kind of sugarcoated, saying that we can still cope. But I want to lay the facts out to the public. I think the healthcare system may just break very quickly. So the least we can do for the healthcare workers is to wear the mask on. You see, the healthcare workers are putting their best foot forward to protect as many people and help as many people as possible. Then I'm going to ask you to put your best mask forwards and keep it on as long as possible so as to cut down the workload for the healthcare workers.
So, Dr. Leong, help us understand as we, our plans to transition into endemicity. So, under what conditions then would it be okay for us to be mask off, say in 3 scenarios, outdoors, indoors, or even for good, in terms of duration? What kind of duration are we looking at?
Indoor masking will stay on for a long time. And the studies have shown consistently indoor transmission rates very, very high. So I expect that to be one of the last things to go. Outdoor, I do expect it to go away when the numbers of new cases there are starts coming down and plateauing at the number which the healthcare system can cope. If the healthcare system can cope, we can even consider masks off. Certainly not now, perhaps 9 months later, possibly. Masks off altogether, that's when everyone that can be infected is infected or has been vaccinated. When that level is achieved, then perhaps we can take off masks altogether. That may unfortunately take 1 to 2 years. And honestly, I hate predicting. For all the predictions which I've made for COVID-19 since the beginning, I've got them all wrong. So chances are I'm going to get this all wrong as well.
Well, thank you so much for your candid sharing, Dr. Leong, and of course for setting aside time to speak with us. That was Dr. Leong Hoe Nam, an infectious diseases specialist from the Rophi Clinic at Mount Elizabeth Novena.